So today we're talking about compliance and raw, especially targeted towards ventilators. And so to begin, I just kind of want to talk about what is compliance, what is raw, and then I also want to explain what PIP and plateau measurements are. And those are going to help explain compliance and raw on a ventilator. And so with raw, that's basically airway resistance or resistance of the airway. And that is the idea that to move air in and out of your airway, there's going to be a little bit of friction that's caused, but there should only be a specific amount. And when that measurement of raw goes up, that literally means that your airway is becoming constricted. It could be the muscles are broncho constricting, and that you might need to just open them up so air can get in and out of the airway. And so then with compliance is essentially the definition. What is the ease at which something can distend? And so if you apply this to the alveoli, how much and how easy is it for that alveoli to open and to really get that air and do external respiration, and move those gas exchanges and allow all that to happen. But how easy can that alveoli exchange and do those things and open up? And so when you're on a ventilator, there's the measurement PIP, and that's your peak inspiratory pressure. That's the highest amount of pressure that's needed for those alveoli to push the air in and get those open. And so with that being said, there's also then an inspiratory maneuver that's done. And so they give you the gas, and then you press this inspiratory hold, and then it will, it's still part of inspiration, but it'll hold at what level you need of pressure to keep those alveoli open. And so that is the plateau. So you have the PIP, which is the high amount of pressure, and then the plateau, which is the pressure needed to keep those things open. And then the last term is PEEP. PEEP is essentially when you exhale, most of us, we exhale to a baseline of 0. And that's like a full exhale. But when you give PEEP, it gives an amount of pressure that they can't exhale past. So if you had a PEEP of 5, instead of breathing to 0, all your air out, it would only keep 5 open, or it would breathe down to 5. And what that means is, essentially, it would help keep the alveoli open just a little bit so they don't collapse or collapse fully. And so with these different measurements, with raw, going back to raw, you look at what the person's PIP is, and then you're going to subtract the plateau from it. And that should give you a measurement on a ventilator normally around 5 to 10. And so what that says is that, like, for example, if the PIP goes high but the plateau's there and you see that measurement growing to 12, 14, something like that, you're going to know that they might have some constriction going on of their airway, that those are tightening up, or there's something going on causing resistance in the airway. And so to do with that is that what's most recommended is to give a bronchodilator, which would be like albuterol, or another popular one is Duoneb, because it has a little bit of Atrovent in it, but it's still based on albuterol. And so you can give those medications, and how do you know if that's going on? And you can also listen. You'll hear wheezing, or maybe rhonchi even, because rhonchi could make the PIP go up. But those would be things that your raw goes up. And so you're going to see the high PIP, but the plateau's down a little bit, and you're going to be able to calculate that difference and see that it's over 10. And so then going on to compliance. And so compliance, I said, it was the ease at which you could distend, and in this case, the alveoli. How easy is it to get those alveoli to open? And so if it's really, really easy, they can really expand. That's typically more of an obstructive disorder. And with those are like your COPD, chronic bronchitis, CF, those kind of patients. But then when you go on the restrictive side, which means they kind of have stiff lungs, or it's really hard for them, or it takes more pressure, it's harder for them to open up and for them to distend, Those are more restrictive processes. So that could be pleural effusion. That could be any sort of edema that's going on. It could be even atelectasis, so they're collapsing. There's a lot of things that it could be. And so what you would see with those restrictive diseases, you're going to see not only the PIP going up, but you would also see the plateau going up. So those are both going to go up together. So if you calculate it, there might be a little bit of raw, but mainly the main issue is that both of those terms are going to go up. And you're going to hear that through crackles. Or if it's really, really filled, you might even hear diminished. You could even, if there's really nothing going on in the alveoli and air's just moving in and out, you could hear bronchial breath sounds. So with that stuff, a lot of those, you had to just treat it on the restrictive condition. Because if it was pneumonia, you might have to give an antibiotic. If it was, the edema, you give Lasix to really drain it out. But those are the things, in doing those different calculations, you can kind of see what a patient's compliance is, what a patient's raw is. And then lastly, quickly, to finish up compliance, so I said for raw, you would take PIP minus the plateau. And then, so for compliance, there's actually two measurements you could do, but typically the one for static compliance, you're going to take the tidal volume, you're going to divide it by the plateau minus your PEEP. So you're taking out the pressure that you're keeping the alveoli open when you fully exhale. And so that will give you the static compliance. And that should normally be around 40 to 60. And then if you want to do dynamic, it's a very similar calculation where you do tidal volume over the PIP minus the PEEP. And so for that calculation, it's usually just slightly lower than static, maybe around 30 to 40. But of course, you have to look at all the patient, always assess the patient and see what's working for them, what makes sense for them. So that is raw and compliance.